All right. Okay. So good morning again. Yeah. So very good. So coming back to our problem. So we are discussing about the bone marrow aspiration. Okay. So unit 2 is all about bone marrow aspiration. A quick recall of what we did. So initially we discussed about bone marrow anatomy, its composition, functions, etc., and the cells present in the bone marrow. And in the lecture 2, we focused about aspiration of bone marrow. What is the simplest definition? In the aspiration, we are obtaining the fluid portion of the bone marrow. Okay. In the fluid, we have the cells. Cells suspended in the bone marrow fluid is called as bone marrow aspiration. Okay. And this biopsy is called as bone marrow biopsy is called as bone marrow biopsy has another word, Trephine biopsy. Okay. So listen, I just want to make clear here. When we didn't get cells or fluid from the bone marrow aspiration, when we failed at getting fluid, that indicates the bone marrow might deplete it. It became a condition of aplastic anemia, a cancer condition, or myelofibrosis. The bone marrow becomes fiber. Okay. In such cases, when there is no fluid, we are proceeding for biopsy. Okay. Biopsy is better than aspiration actually. Okay. Biopsy will give the bone marrow architecture also. Okay. So that is the significance of biopsy that we will see. Then we quickly discussed about how to obtain an aspiration and biopsy. It's a simultaneous procedure. First we will aspirate with the same needle. We are going for biopsy. Okay. So there are few sites. Here, the best site will be always iliac crest, anterior or posterior. If not, then in children what we are using? In children we are using what? Yeah, the tibia bone. Okay. So the upper portion of tibia will be used for children. Okay, in case. Okay, and we discussed about its procedure and the spinal process also in children, but very careful, sensitive procedure. And what are the three needles we are using? For biopsy we are using Jamshidi, and for other two Sala and Klima needle we are use the parts we have seen. Then we discussed about the procedure and contraindications, anesthesia, everything we have seen, complications, and sterile conditions such as the donning and doffing of PPE we discussed. Then we discussed patient preparation, procedure, etc. So after that we discussed about how to qualify a good sample. Okay, parameters to qualify a good sample we discussed. Then we discussed about dry tap. What is the meaning of dry tap? Failure to get a sample. Okay, dry tap doesn't mean the bone marrow failed. Okay, here we failed technically. When we are drilling, we failed at achieving the reaching the bone marrow. That is called dry tap. Okay. Or other reasons for dry tap might be these things, aplastic anemia, etc. In case of dry tap, we are proceeding for the biopsy procedure. Right. Then in the third lecture, we discussed about processing of the biopsy sample. How to process the blood sample for the purpose of aspiration and biopsy. Let me be clear. Processing for only aspiration, not biopsy. In today's lecture, I will discuss about bone marrow biopsy processing. In last lecture, we discussed about processing of aspirate. In today's lecture, I will discuss about processing of bone marrow. Okay. So don't get confused with aspirate processing with marrow processing. Okay. Biopsy processing, I mean. In case of aspirate, here we are hardly doing only smear preparation. There are 4 types of smear preparation in aspirate processing. What are the 4 techniques? Sledge, cover slip, imprint, and crusher smear. So that is what we emphasize in this actually. These 4 things we minded in the aspiration preparation. Okay. So of course the same thing we discussed. Then we also discussed about adequacy of the sample. Okay. The right thing. Then we discussed the basic staining, that is HMD staining. Okay. We discussed about the presence of adequate amount sample in the smear. For that we need to understand various things. Aparticulate, hemodiluted, scant, fatty, particulated, extra particulate, or rich particulated. This we discussed. Then we discussed about the stages of cancer and the abnormalities. And a quick review. Decrease in size of cell is called as decreased cell size is called as atrophy. Increased cell size, very good. Increased cell count, hyperplasia. Then abnormal undifferentiated growth. Okay, growth is called as dysplasia. Dysplasia leads to neoplasm, stage 1 of cancer. Same thing we discussed. Very good. Then in the yesterday's lecture, we discussed about ME ratio, or the evaluation or calculation of cells in the aspirate and their counts and ratios we discussed in yesterday's lecture. Okay. Yesterday we discussed mainly about the ME ratio. What is the full form of ME? Myeloid to erythroid ratio. Yesterday I made a small mistake because I didn't prepare for the class. In the erythroid lineage, only red blood cells will present. Okay. The stem cells that leads to a red blood cell formation. Okay. I made a mistake where I said other granulated cells in the erythroid lineage. I am wrong. Okay. So we are focusing on myeloid lineage and red blood cell lineage. Okay. ME ratio. So what is the significance? So see, this is the one. This is complete myeloid lineage. Okay. And this is the erythroid lineage. So the total number of myeloid divided by the total number of erythroid cells. That is what we are seeing in ME ratio. Okay. There might be a reason why we only focusing these two rather than others. Maybe in the future lecture I will try to answer them. Even I don't know why they only chose myeloid to erythroid ratio. Why not others? I don't know much. Anyway, so a quick review of yesterday's lecture. So we have seen the normal count of differential count of blood stem cells, okay, and then a percentage. Then we also seen the interpretation of ME ratio, right? So keep in mind, ME ratio is myeloid to erythroid. We already know this one. Then the interpretation. If the myeloid cells are more than 4, that indicates myeloid hyperplasia or erythroid hypoplasia. If the ratio is less than 2, myeloid hypoplasia and erythroid hyperplasia, vice versa. And the normal count is this one. And we have seen that associated clinical significance. Okay. So one of the important topic for your exam. Now, in today's lecture, we will discuss about bone marrow biopsy processing and interpretation. Okay, bone marrow biopsy sample processing plus its interpretation. Its interpretation. Its interpretation. This will be our final lecture. Lecture 5. Okay. Processing and style, simple. You write that heading, that will be easy. Bone marrow biopsy sample processing and its interpretation. How we are interpreting the results. Okay. So, as we understand, this bone marrow biopsy is also called as cylindrical biopsy. Okay. Since we introduced a cylindrical needle into the bone marrow and we have obtained a core of the bone marrow which looks like a cylinder. Okay. So this is also called cylindrical biopsy. Okay. So you can see adult bone marrow very thick and rigid, and infant bone marrow. You just imagine just born infant got a biopsy, bone marrow biopsy. Maybe infant has some problem. Okay, very painful. And fragmented bone marrow. Okay. So yeah. So we'll see how we will process this sample. I'm not going to touch how we are obtaining the sample. That we already finished in the day 2. Okay. So we are not minding about patient preparation or collection. We are only minding about the processing of the sample and the results interpretation. Okay. Whenever there is the word biopsy. Can you define what is that biopsy is? How biopsy is different from autopsy? How biopsy is different from autopsy? Tell me, students. What is autopsy? Obtaining a sample from a dead person, dead patient, cadaver is called as autopsy. Biopsy means obtaining a sample from living person is called as a biopsy. Very good. The primary purpose, by the way, I need to write the breakdown of lecture, right? A quick breakdown, what I will focus. So in today's lecture, we will discuss about its introduction or definition, and I will focus on the steps of processing that include fixation, decalcification, then I will focus on tissue processing. In tissue processing, I will focus on dehydration, clearing, infiltration. Then I will want to introduction. Then let me go with 1 to 3. Okay, in 3, embedding, 4, sectioning, 5, staining. Don't mind about my writing, okay? I want to finish lecture quick. Anyway, in staining we have two main things: HND staining and special stains. Okay, in case of special stains, we are going to focus 4 important or 5 important that include reticulin stain, reticulin stain. Then I will focus on Manson's trichrome stain. Then periodic acid shift stain, Ginza and iron stain. Iron stain is also called as Persian blue stain. PURSSI, Persian blue stain. Then I will go further with the 6th one. IHC, immunohisto or chemistry. IHC, here we will say direct and indirect. Then I will focus on comparison of bone marrow aspirate versus bone marrow biopsy. And last and final, results interpretation, troubleshooting. Then last and final will be significance. I think this is my first time I'm using board that is lower to my feet. Anyway, this will be my flow of today's lecture. Okay. So listen. See, suddenly you are seeing some trend in this flow. What is that? Suddenly it is shifting towards histopathology. Do we have histopathology subject? Tissue processing. Yes. So we are going to do all tissue processing steps for biopsy. Because this is a biopsy sample at the end of the day. And biopsy sample must face or undergo tissue processing steps. Right? Now listen. I know it will be slightly boring, but I'm not, I don't make it bore. I know because Manorajans are already teaching this subject. But anyway, let me define my perspective of tissue processing. Listen, whenever, before this one, I just want to tell, what is the primary purpose of processing? What is the primary purpose of tissue processing? Can you tell? Why do we need to process the sample? Why we are doing all this boring, lengthy, time-taken, painstaking procedure? Why we are subjecting the sample to these torturous, stages? Why we are doing this one? Have you questioned yourself? Why the hell we need to process the sample in the beginning? You know the reason? Simple. Whenever we, I give him an analogy, I guess. Imagine we have a chicken, okay? I cutted it, and I kept the chicken leg piece on this table and we left it for 1 week, what happened to the chicken piece? It will start decomposing, right? It will smell bad, right? That means once the animal dead, the tissues will start decomposing. The tissues will die, okay? Cellular death will happen. Cellular death leads to loss of tissue anatomy. We can't see the tissue anatomy, its structure anymore because it's dead. So the first purpose we need to do is we need to prevent the meat from spoiling. That means we need to preserve it. How we will preserve? That will be discussed here. After preserving, one more problem we have. The problem is the ultimate aim of processing is to study the tissue under the microscope. Okay. We are trying to preserve the microanatomical structures of the tissue. This is the primary purpose of tissue processing. At the end of the day, we will observe tissue under a microscope. That's it. Okay. This is the primary agenda of processing. Now there come some problems. Okay. The problems are, how many of you know about Egypt, mummies, Egyptian mummies? We know, right? So let me tell you one thing. The first agenda is to prevent decomposing, right? So can I say that Egyptians are already doing tissue processing since 2,000-3,000 years ago onwards, right? Technically, Egyptian mummies are a preserved bodies. Their tissues are preserved. So Egyptians already know how to preserve the tissue. Am I correct? So mummies are living proof. Not mothers, the mummy, Egyptian mummy. Right? Very good. Then, if that is the case, let me ask you another question. How many of you are ready to eat mummy biryani? You don't like mummy biryani, right? Let me prove it. Okay. What if I say we are already eating mummy biryani? Mummy biryani. So we know only why noodles, not such things, right? Let me tell you then. How many of you like dry fish? What is dry? What is a dry fish? It's a mummy of fish, right? Literally we took the fish, we dried it, so it's preserved and we are eating. When you are comfortably eating dry fish, what is the issue when I say, mummy biryani? In one way we are still eating dead bodies. Dry fish curry, right? Or then there is a challenge. Sir, these things only reserved for these meat-eating fellows. I am a Brahmin or I am a vegetarian. I don't know such things. I am a very good. Okay, if you say if you are a vegetarian, let me tell you. Okay. How many of vegetarians ate pickles, mango pickle? Right? Mango is a mummified, material of mango that is harvested from 1 year ago from the tree, right? We suspended mango in a oil with salt. So what happened here? How Egyptian mummies preserved? The simple rule is the most baddest culprit is water. Actually, not even microbes. Microbes need water for their survival. If we remove water from the tissue, microbes cannot decompose the tissue because they need water for their growth. So the idea is what are the ways to remove water from the tissue? One technique, take a dead body, cut the, remove the visceral organs, stuff it with salt. That's it. Salt will remove the water. So you are preserved for a lifetime. You will become King Ramses, okay, or Egyptian Queen Cleopatra, or one of the famous, right? Anyway, same thing we did, either by salt, dehydration, or we are suspending in a oil. So oil will make as a permanent barrier from environment. So oil will prevent anything to enter inside. And also we did one more torture for oil, mango pickle. We already subjected these pieces to, we will keep that salt and pepper to the mango pieces. The salt will remove the or this one, okay, the water. That's why if tomorrow is Sunday, in Isol, I got this issue. Okay, can you not tell this side? I think now it's detecting see your face. I am the one, okay? Okay, never mind. Sunday issue in Isol, okay. When I came to Mizoram, I got this issue that Sunday is just like almost there's no difference between foreign side and Sunday here. I mean, nothing is available outside, right? So if you bring chicken on Saturday, the first thing you need to do is after cleaning it, heat some salt to it, okay? Salt and pepper, okay? So it will be preserved for next day. We are taking lessons from science. Okay, that is clear. Now let us come back to our tissue processing. Some more interesting things. See, let me give you an analogy about. I have given you the sharpest to the sharpest knife in this universe. Very sharp, okay? Very sharp knife you have. And I given two samples to you. A piece of cake and a potato. Okay? I given a piece of cake and a potato. Now I requested you to cut the cake into very thin slice. Slice, thinner than this paper. Okay? First, I requested you to cut the potato. Can you able to cut it? You can cut a very thin potato slice. Now, I need the same potato, slice thickness of your cake. Can you cut your cake into as thin as your potato slice with the sharpest knife in this universe? You can't, right? What is the problem? Why you can't cut cake into thinnest slice? Because cake was very fluffy. Even though knife was sharp, when we are touching it, it will squeeze. The cake will squeeze, right? That is the same problem we are facing with our tissues. Our tissues are like a piece of cake, not like a potato. Okay? Even though we have the sharpest knife, when we are trying to cut the tissue into slice, it won't cut. Okay? Just like the problem with the cake. Then how to overcome this problem? Somehow we need to obtain, there is no other option, we need to obtain a thin slice of cake. How to do it? We know here, why potato slice? Because potato was hard, but our cake was not hard. Now we need to identify some ways to convert cake into hard cake. How to convert my soft cake to hard cake, okay? Now comes our techniques. What we will do? First I will remove water from my cake. Okay, I have removed water from my cake because water is one of the culprits for decomposing. How I remove the water from my cake? I will subject this cake either to a straw where it will dehydrate or alcohol. Alcohol is one of the powerful dehydrant and alcohol will remove water from substances. Okay, so that's why the pirates, their water used to be spoiled. So in their water they used to keep some rum. So rum used to preserve their water for long voyages, 7-8 months voyage. And that's why pirates like rum, okay. Actually rum was invented by pirates to preserve the water. Okay, alcohol is very good dehydrated. So once we are removing water from the tissue, there is one challenge. The challenge was, the tissue will be shrinked now. If we remove water, tissue shrinks. If we shrink the tissue, we can't see the cells. That water should be replaced by something else. Okay. In place of water, some molecule should be replaced. Okay. Now we will replace it with xylene. Okay. That is called clearing. After dehydration, we are going for clearing. That will be xylene. Okay. Now, if we are using xylene, why this step is called as clearing? Why this is called as clearing, by the way? Listen, when we take this slide to the tissue, okay, tissue to a slide, the slide has a refractive index. Light once it bended, it will go like this. The refractive index of the slide is 1.4. Okay, Ri. Okay, now listen very carefully. If I keep any material, maybe a normal oil, if that oil Let us see. First, light bended here and light again bended in the tissue. Then we will get a blurry pictures. If I use a normal oil within the tissue, the light will bounce 2 times and whatever I am seeing under microscope will be blurry. I need a material that has refractive index equivalent to the glass slide refractive index. RI of 1.4, RI of 1.4, so the light will go properly and it will give a clear picture. So that is why this step is called as clearing step. You use anything, at the end of the day my tissue should be clear under microscope. The light pathway should be clear. And one of the best RI, glass slide RI reagent is xylene. Xylene has the same RI as a glass. That's why we are using xylene as a clearing agent. Okay. Now, slowly what we are going to do is, we replace water with xylene inside the tissue. But still, xylene is a liquid. The tissue is still fluffy. Now what we are doing? We will submerge this tissue in a liquid wax. Okay, we are keeping this in a liquid wax. Once we heated the liquid wax, it will become solid, liquid, right? So, we will suspend it in the liquid wax. That is called infiltration. Now the wax will enter inside the tissue. Xylene will come outside. That is why this step is called as infiltration and impregnation. Infiltering of wax inside and impregnating outside. Something coming out, okay? Infiltration and impregnation. After suspending tissue in this liquid wax, if we remove and let it dry, what happens? It will become a hardened tissue. Okay, a small hardened waxy meat will be there. Now this waxy meat ball, we should hold it, and each meat ball will be its own shape. Okay, so we want to standardize the shape. To standardize the shape, what we did, we took this sample and we made a mold. In that mold we kept again. So we took a L mold, okay, like this L mold. We made a tissue and we made a small waxy block. That is called embedding and block making. After making the block, this block will be cut into slices. Section cutting. What is the machine that is used for section cutting, by the way? Very good. Microtome. Okay, tome means slice. Micro means small slices. If we use computer to get slices of body, that is called computer tomography, CT. So that is how CT became CT and the microtome became tome. Okay. You got my point? What I said? Yeah. CT scan is of slices of body. Okay. Sections we did, then we are going for staining. Okay. Until here looking normal. For a normal tissue. Now listen. Our knife, our microtome knife is, of course it is very sharp, but also it has a problem. If we encounter a hard object, the sharpness of this knife will be broken. It will be less. Now the knife will have a nicks and ticks. Nicks and ticks means knife will become rough. If the knife become rough, the problem is we will get a lace chips rather than smooth chips. Okay, I mean that up and down slice. Okay, rough slice. We don't want a rough slice. Okay. Now listen. Our bone marrow biopsy, of course, has a residual bone, that is calcium. If we directly take bone marrow biopsy and do tissue processing, we are potentially damaging the microtome. Also, we are damaging the sample because we won't get a clear picture. Because the bone particles will interfere with the section cutting. That is why bone marrow sample always after sectioning, we must subject it to, okay, first we fix the sample. We immediately after obtaining bone marrow, we suspended it in a fixative. It can be any fixative. Okay. After fixation, this is the important step. Write down. Decalcification. I hope you know what is decalcification, right? Yes, sir. Here, the calcium will be removed from the tissue. Without decalcification step, we should not subject it to the tissue processing.
Decalcification is one of the important steps in bone marrow biopsy. Okay. If we not do decalcification, it leads to this one. Now, can you give me one explanation? If you see here, one of the ingredients, one of the method of decalcifying is EDTA. Can you guess how EDTA will decalcify the tissue? They are saying that take a EDTA solution, keep the bone sample in it, and it will decalcify. How? We know that EDTA is an anticoagulant. But how EDTA can do decalcification? Can you guess? How EDTA can achieve decalcification? Is my question. What is the other name of EDTA? It is also called as chelating agent. What is the mode of mechanism of chelating agents? They will remove calcium from the blood. In this case, calcium from the bone marrow. Or I can tell you one, I think even in YouTube we have many examples. Take a chicken bone, suspend chicken bone in a decalcifying reagent. After 1 week, the bone will become rubber. Because no more calcium, only the leftover will be the collagen fibers. So literally we can make a bone marrow, knot. I mean bone knot. Okay. Knotting, right? That's correct thing. So we can make bone into rubber with decalcifying. That's it. That is called decalcification. So I hope you are clear about what is decalcification. Next, processing. In processing, the same old techniques: dehydrating, removing the water, clearing with xylem, then infiltrating with liquid wax, that is paraffin wax. Okay. Why we purposefully choose paraffin wax? Because it has a low melting point. What is the melting point of paraffin wax? Can you tell? Around 56 to 62 degrees centigrade. Okay. So that is the melting point of paraffin wax. Okay. Next, embedding. We made a block embedding and block making. After block making, we went for the sectioning. We cutted the slices, sections of bone marrow. Typical steps. After sectioning, we are going for staining. Okay. So staining, then staining, mounting, and microscopic examination. Okay. Mounting. What is the meaning of mounting? What is the difference between staining and mounting? Have you reached up to this topic in this talk? Then you should tell what is staining and mounting. What is the difference between staining and mounting? Tell. What do you mean by mounting? Just tell me. Shall I say? See, actually, I really don't like you. Either I like you or I don't like you. The don't like portion is you won't respond to my questions. There might be two things or three things. Either I'm not teaching well, or you become zombies, or you become too smart that my question is looking very silly. Don't fall in such categories. Even if you are too smart, still there should be two exchange. Anyway, mounting. Tell me what is mounting. This zombies no. Or you took inspiration from mummies or what? Anyway, listen. When we stained it, if I want to preserve this slide, because this is my cancer patient actually. After giving my treatment, after 1 year, I will take one more biopsy. Okay. Now I need to cross check 1 year ago how the bone marrow condition. After 1 year, after my treatment, what is my bone marrow condition? Right? I need to preserve this stained smear. To preserve that, let me tell you how way of lamination, right? Photos lamination or your degree certificate lamination. What if you are not laminating our certificate? Maybe after 20-30 years, the ink will start fading away. If you laminate it, the fading won't happen, right? Similarly, we need to laminate the slide. The scientific terminology for laminating is mounting. Okay. Simply after staining the slide, we will add some mounting reagent and we will keep cover slip. That cover slip will become attached to the slide permanently. Technically, we laminated the smear. And that methodology is called as mounting. Permanent lamination of slide. Clear? After mounting, we are going for microscopic examination. These are the steps of processing of bone marrow biopsy sample. So far clear? Okay. Then I said only this thing, the staining protocol. Here we are using one H&E staining. You already know what is H&E staining. Nothing much to say. Then special stains. In special stains, we have first one reticulin stain. It will stain the reticulin fibers. Okay, it will stain the reticulin fibers. Reticulin fibers are present in between the calcium of the bone. Okay, bone got the bone shape because of these fibers actually. These fibers gave the shape in that, in between them they kept the calcium to make it hard. Okay, so reticulin fibers can be appreciated or visualized with reticulin stain. Okay, this will be the reticulin fibers of bone marrow. Okay, then we have Manson's trichrome stain. This stain is very good at attaching to the collagen fibers. So the collagen can be visualized with the help of Manson's trichrome stain. Okay, and associated condition. Then periodic acid shift stain is used for staining the glycogen. This pass was very good for detecting lymphoid leukemias. Okay, ALL and CLL can be suspected ALL, lymphoid leukemia cases. We will go for pass staining. Okay, lymphoid leukemia will be stained with pass. I think here is some insect and I captured it. I thought something, but it's ran away. See? Next one, iron stain. So there is a cancer condition where iron will be deposited in the bone marrow. Very, very dangerous condition. Such iron deposits will be visualized by a special stain called Persian blue stain, which is also called iron stain for visualization of iron deposits within the bone marrow. Okay, so these are the special stains that we are using for bone marrow biopsy. Then we have very interesting thing. What if we want to detect one particular antigen or protein in the bone marrow? For that we are using something called immunohistochemistry. Simple. We are using immune, that means antibodies, on the histo, that means the tissue, with some chemical reactions to visualize the tissue component. I made it very simple, but it has its own one-day lecture that we don't touch. Simply you remember, immunohistochemistry is a method to detect the protein markers of the cells of the bone marrow biopsy. The protein markers can be, the protein markers including CD34, 320 for various cancers will be detected with the help of IHC. Or simply, if we don't have one flow cytometry, we can do manual flow cytometric test. That will be the immunohistochemistry. This is the test before flow cytometry invention. Okay, simple. Next one. So a quick overview of bone marrow processing. So we did all tissue processing steps, as simple as that. Fixation, decalcification is major important point. After decalcification, your traditional processing steps: dehydration, cleaning, emery, sectioning, staining, and the mounting. Clear? Then, what is the difference between an aspirate and a bone marrow? So, the architecture of the cells, here only cells can be seen, but the bone marrow tissue architecture can be studied in the biopsy. Then cellularity, okay, assessed by particles, but here it will be assessed more accurate, because here we are getting small granules, particles, that is not sufficient. So biopsy is always good. And fibrosis detection. What if my bone has some fibrosis and that cannot be detected by fluid, but that can be appreciated by a biopsy one, okay? Then abnormal infiltration of any cancerous lesions can be seen by a biopsy. So that's it. And dry tap. Whenever there is a dry tap here, biopsy is the best thing to identify the root cause of dry tap. Okay, the dry tap root root cause can be detected by biopsy. Reporting. A typical bone marrow biopsy report should have the following things: the cellularity, fat presence or absence of fat, distribution of hematopoiesis, that means all types of blood cells, presence of abnormal or abnormal cells and infiltrates, fibrosis or reticulate presence, and iron. Is there any iron in the bone marrow and the bone marrow structures? So these are the points we will mention in bone marrow report, bone marrow biopsy report. That's it. So there are some troubleshooting. What if we didn't get you encountered a problem and its solution. Okay. So some of the problems: poor nuclear staining, maybe inadequate fixation and its solution, etc. Okay. So what is the major significance of bone marrow biopsy? The significance is to check the hypercellularity or hypercellularity, to check the fibrosis status, to check any granuloma formation. Granuloma is particularly seen in what condition? You already seen, I guess. Do you remember? I said even Egyptian mummies used to have tuberculosis. So tuberculosis we identified because granuloma formation, nodules in the bone marrow. Okay, granuloma formation. Malignancy and abnormal tubercles or nodules can be detected by biopsy. This is all about bone marrow biopsy and its significance. Any more doubts in this topic? No, right? Thank you very much. So we have officially finished unit 2. Okay. So there is a bad news for you. Tomorrow there will be a class test. Okay. On the topics of weekend work 2 and 3. Whatever topics I given in weekend work 2 and 3 will be kept. Now let me tell you good news. The class test won't be a written test, only an MCQ based. We can finish in a matter of 10 minutes. Then we can have one more story, okay? After finishing of every unit, we'll have one story, okay? Maybe we'll take another side dish and their contributions. Alright, thank you so much for your today's attention. So get prepared for class test.